44-year-old Connie Lee has a brand new left hip thanks to an historic and revolutionary new procedure performed for the first time ever in Michigan at the Detroit Medical Center's Huron Valley Sinai Hospital. Orthopedic surgeon Dr. Philip Schmidt is not only the first in Michigan to perform the surgery, but he was among the first in the nation to be trained for it in Birmingham, England. That's where the procedure, Birmingham hip resurfacing, gets its name. It is a bone-saving alternative to traditional hip replacement.
It's a fantastic procedure because it's a very, very, very good option for younger patients. That being patients younger than 60 years of age that have bad arthritis in their hip. They tend to wear out the components that we put in them. Most total hip replacements last about 20 years or so.
That means more surgery later, surgery that is rarely as good as the first. Connie is the perfect candidate, young, active, with strong bones, but a lot of pain.
I always knew it was there. It would grind. I couldn't sleep. I couldn't lay, sit, stand. There was basically no relief.
The Birmingham hip resurfacing has several advantages over traditional hip replacement. With the traditional method, the entire hip joint is removed and replaced with a metal joint and plastic cup. With the Birmingham hip procedure, the arthritis, which causes so much pain, is simply shaved off the head of the hip bone, which is then covered by a metal cap that's inserted into a metal cup.
It's a metal-on-metal hip, so there's much less wear. And actually, the way this is machined, you get some hip fluid in there, and this component actually hydroplanes. There's not actually a metal-on-metal contact.
And as you see here on the right, the Birmingham hip system preserves much more of the patient's natural bone structure.
This allows them to have greater range of motion, allows them to be much more active, and it also is a lower wear component so that it'll last longer.
In fact, it's been shown that the Birmingham hip's metal-on-metal joint is 98% more wear resistant than traditional metal-on-plastic hip implants. The approach reduces the post-operative risks of dislocation and inaccurate leg length, and the all-metal implant lasts longer than traditional hip implants. Recovery time is also reduced, as is the need for a second surgery down the line, which is common for total hip implant patients. That greatly appealed to Connie, who was up and active days after surgery.
And I've been playing putt-putt and going on boats. I've been doing laundry and cleaning houses and doing all kinds of stuff.
So you're just a happy camper.
Yes, I'm very happy. I wouldn't change a thing. I'm glad that I met Dr. Schmidt.
The Birmingham hip resurfacing procedure at Huron Valley Sinai Hospital, one of 9 hospitals of the Detroit Medical Center, where many of our doctors are ranked among America's very best physicians. The DMC, we just think it's a better way to get better. I'm Emery King.